Today's video we're going to talk about rotator cuff. Rotator cuff disease is very, very common. Essentially it's an epidemic in the United States. And as the baby boomers are maturing, we see more rotator cuff problems every day. The common question that we get asked is when am I going to need rotator cuff surgery? And there's really a spectrum of rotator cuff disease that we'll talk about in this video. So the rotator cuff is four muscles, and I'll use this shoulder diagram to explain it. You have two muscles on the top. One's called the supraspinatus and one's the infraspinatus. The supraspinatus is the one that's most commonly torn, and it's the one that we most commonly see in the clinic. The subscapularis is the muscle in the front, and the teres minor is the fourth muscle, and that's the muscle in the back. The rotator cuff, interestingly, with rotator cuff pathology, it's really the tendon that is involved. And what happens is that the tendon, for a cuff tear, for example, the tendon will pull off of the bone, and it's not really the muscle problem. It's that becomes pathologic. It's truly the tendon that pulls off of the bone that we have to reattach in rotator cuff surgery. So the typical causes of rotator cuff problems are many. One is trauma. If somebody has a fall from a height, they fall on their arm's in an awkward position, that can be one cause of rotator cuff disease. The second cause, or one of the second major reasons is over time, more of a chronic, repetitive overuse type of activity, such as reaching overhead for the job or sport. Those are some of the common causes of rotator cuff problems. The majority of rotator cuff surgery, or the majority of rotator cuffs are typically treated conservatively initially. One of the main indicators to go towards surgery right out of the gate is a trauma. So if somebody falls down, they can't raise their arm, and they've torn their rotator cuff, that's an indication oftentimes to proceed directly towards surgery. That being said, the vast majority of rotator cuff problems that we see are treated conservatively because they're not secondary to one event. Oftentimes it will be a situation where the patient will come in and they may have had 2, 3, 4 months of chronic of shoulder pain that is worsening. Some of the typical symptoms are pain at night, pain going down the lateral aspect of the arm, pain with overhead activity. It can be weakness, and really it's just where they're starting to lose the function of their shoulder. We see those patients, and oftentimes you'll start with an anti-inflammatory, naproxen or ibuprofen. Oftentimes we'll do a steroid injection. These are done under ultrasound guidance, typically, to make sure we're in the exact spot that we want to be in. And we typically will couple this with physical therapy. And the reason we do that is, for example, if you do a shot, you're going to improve typically, so the shoulder feels better. Oftentimes, specifically for people who've had issues for 3 or 4 months, there's some underlying shoulder dysfunction from a muscle standpoint. So what we do is we'll inject the shoulder and then the patient will feel better. However, there's still underlying issues that, if not addressed, the shoulder pain might return. So what we'll do is we'll couple this with physical therapy, and usually it's a fairly short course, anywhere from 2 to 4 weeks, depending on the significance of the problem. And after that, typically patients are done with their treatment. The surgery for rotator cuff is performed as an outpatient, and given the size of the tear, it may take between an hour to 2 hours. So patients do go home the same day. From a pain control standpoint, we recommend doing a block before surgery, and that is putting numbing medicine around the nerves in that region. So when you wake up, you have minimal, if any, pain in the shoulder, which is very nice. The way the rotator cuff is fixed, it's fixed through small little poke holes. It's minimally invasive surgery, so when you have to reattach the tendon back to the bone, and there are different techniques to do that. One of the common techniques are using what we call anchors. Anchors are very small devices, and they look about the size of a .22 bullet with threads. And the deal with that is you put the anchor into the bone where the rotator cuff used to be attached to, and then in the anchor there are thread and sutures. and then you suture the torn rotator cuff and you tie it back down to the bone. So essentially that's what rotator cuff surgery is. The rotator cuff recovery time is slow. So initially patients are in a sling, they wake up in a sling. We allow passive motion, meaning you cannot use your arm for approximately a month. We begin therapy at week number 1. And the deal with physical therapy is the therapist will move your arm, and we call that passive range of motion. As time progresses, we allow more active motion, and typically at the 6-week time frame, we allow patients to really be out of their sling significantly. At 3 months' time, the majority of patients have all of their motion, but they still do have some weakness that improves with strengthening in physical therapy. The frequency of physical therapy starts to decrease at approximately at that point, and most of the patients are able to do the exercises on their own. Typically from a full recovery standpoint, it's somewhere between 6 to 12 months in improving throughout that entire time frame. The prognosis for rotator cuff surgery is very good. There are variables that do affect the prognosis, and one is patient compliance. So when you're in the sling, you're really doing no active motion of your arm, and that's for a period of 4 to 6 weeks depending on the type of your tear. It's very important to follow that protocol. Studies clearly show that early motion can result in a failure of the rotator cuff. Other factors that are important are general nutrition. It's important to have a good, healthy diet, so it allows your body to heal, and also compliance with non-smoking. It has been clearly shown as well that smoking inhibits healing in tissues. Physical therapy is very important for a successful outcome from a rotator cuff surgery. Initially, we allow passive range of motion. We start therapy early. Usually it's within 1 week, depending on the size of the tear. And then we graduate going from passive range of motion to where the therapist moves the arm to active assisted, where the patient begins to move the arm with the help of the therapist, and then eventually active motion where the patient is lifting their arm under their own power. The vast majority of patients, I think, that fear surgery on the rotator cuff because they hear a lot of stories from a pain standpoint. And I will say that we've really improved those techniques over the past decade. So don't live with significant shoulder pain or dysfunction, because there are many things that we can do conservatively as well as surgically to get your shoulder feeling better. If you have any questions or comments, please leave those in the comment section below. Thank you for watching, and please subscribe to our YouTube channel.